In this session, we are going to be looking at landmarks, quadrants, and regions of the abdomen. Hi everyone, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the objectives that we'll be addressing in this session, such as anatomical mapping, the anatomical landmarks of abdomen, the quadrants of abdomen, the organs in each quadrant, the regions of abdomen, the organs in each region, and finally, the significance of landmarks, quadrants, and regions of abdomen. To introduce the concept, surface anatomy, it is also called superficial anatomy and visual anatomy. It is the study of external features of the body of an animal. It deals with anatomical features that can be studied by sight without dissection, meaning cutting open. It is a branch of gross anatomy along with endoscopic and radiological anatomy. It is also a descriptive science. So now, in particular, in the case of human surface anatomy, these are the form and proportions of the human body and the surface landmarks which correspond to deeper structures that are hidden from view both in static pose and in motion. Anatomical mapping. This helps pinpoint the location of findings during the abdominal assessment. There are three ways to identify the location of these findings, namely anatomical landmarks, the four-quadrant method, and the 9 regions of the abdomen. Anatomical structures are used as landmarks to help describe the abdominal findings. The following structures are used, that is, the xiphoid process of the sternum, the costal margin, the midline with the umbilicus at the center, the anterior superior iliac spine, the inguinal ligament, and finally the symphysis pubis. Now let's look at the anatomical landmarks of the back. The costovertebral angle. It is the acute angle that's formed on either side of the back between the 12th rib and the vertebral column. The significance here is costovertebral angle tendinous, otherwise called as Murphy's punch sign, Pasternakis sign, or Goldflam sign. It is pain that is elicited by percussion of the area of the back overlying the kidney, that is the costovertebral angle. This particular test is positive in people who have perinephric abscess, pyelonephritis, hemorrhagic fever with renal syndrome, or renal stone. Another way to mark the location of abdominal findings is by the four-quadrant method. To use this method, draw imaginary lines separating the abdomen into four quadrants. They are the right upper quadrant and the right lower quadrant, the left upper quadrant and the left lower quadrant. So how the lines should be drawn? Draw one imaginary vertical line at the midline and the horizontal line at the umbilicus. These lines should intersect at the level of the umbilicus, thereby dividing the abdomen into the before said four quadrants. Now, let's look at the organs in each of the quadrants. The first, right upper quadrant. The organs are liver, gallbladder, pylorus, duodenum, hair of pancreas, right adrenal gland, portion of right kidney, hepatic flexure of colon, portions of ascending and transverse colon, and the right renal artery. The organs in the right lower quadrant are the lower portion of right kidney, cecum and appendix, portion of ascending colon, the bladder if distended, ovary and salpinx in female, the uterus if enlarged in female, right spermatic cord in male, right ureter, right iliac artery, and the right femoral artery. The organs in the left upper quadrant are left lobe of liver, spleen, stomach, body of pancreas, left adrenal gland, portion of left kidney, splenic flexure of colon, portions of transverse and descending colon, and the left renal artery. Finally, let's look at the organs in the left lower quadrant. They are lower section of left kidney, the sigmoid colon, descending colon, the bladder if distended, ovary and salpinx in female, the uterus if enlarged in female, the left spermatic cord in male, left ureter, left iliac artery, and the left femoral artery. This slide gives an overview of the organs in each of the quadrants. The third way to document the location of abdominal findings is to separate the abdomen into 9 regions similar to a tic-tac-toe grid. The first 2 lines that you see here are vertical, starting from the midclavicular area to the middle of the inguinal ligaments. The second 2 lines you can see are horizontal, starting from the costal margin and ending at the anterior superior iliac spine of the iliac bones. It's important for you to know the names and the locations of the 9 regions of the abdomen. So let's see how you can remember them easily. Initially, we'll cover the right and the left columns as they have the same exact name, distinguished by a left or a right prefix. They are named after the bones to which they are nearest. First, let's look at the right and the left hypochondriac region. So the prefix hypo, it means below or under, and the word chondriac means cartilage. So here referring to the cartilage of the ribs. So now when you put them together, you get the abdominal region that is under the ribs. Easy? Okay, so now let's move to the next region, that is the right and the left lumbar region. So the word lumbar refers to the vertebrae in the lower back. So they are the bones that are nearest to the lumbar region. So that's how this particular area gets its name. The third column on the right and left shows the iliac region, and the top of the hip bone, okay, is called the iliac crest. And so this is the bone that is closest to the iliac region. So thereby we have completed the right and the left columns. Now let's move on to the middle column. The first area being epigastric region. So the prefix epi means above or over, and gastric means the stomach or the belly. Thereby this region is over and above the stomach. The next region is the umbilical region. The umbilicus is otherwise called the navel. You would have seen earlier that this is the intersection area of the 4 quadrants. And here the umbilicus makes the region which is the middle area in between or among the 9 regions. The last area being the hypogastric region. Here, as seen earlier, hypo means below and gastric refers to the stomach or the belly. So when put together, this region refers to the area under the belly. So this becomes very easier to understand in terms of meaning, thereby helping you to remember. Now let's look at the organs in each of the regions. In the right hypochondriac, the organs are right lobe of liver, gallbladder, duodenum, hepatic flexure, portion of the right kidney, and the suprarenal gland. In right lumbar, portion of right kidney, hepatic flexure of colon, ascending colon, duodenum, and jejunum. In right inguinal, cecum, appendix, ileum, right femoral artery, right ureter, right spermatic cord in male, and right ovary in female. In the epigastric region, pylorus, duodenum, head of pancreas, portion of liver, aorta and renal arteries. In the umbilical region, lower duodenum, jejunum and ileum, aorta and iliac arteries. In the hypogastric region, ileum, bladder if distended, the uterus in female if enlarged, aorta and femoral arteries. In the left hypochondriac region, the stomach, spleen, the tail of the pancreas, splenic flexure, upper portion of left kidney, suprarenal gland, left lumbar, descending colon and the lower half of left kidney. And finally, in the left inguinal region, the sigmoid colon, left ureter, the left spermatic cord in male, left femoral artery and the left ovary in female. Now, let's look at the significance as to why we need to know regarding the regions, quadrants and landmarks of the abdomen. It is to precisely point out the chief complaint of a patient with the exact location. If abdominal pain or signs of peritonitis are localized in the left lower quadrant, it can be because of colitis, diverticulitis, urethral colic or pain due to ovarian cyst or pelvic inflammatory disease. Examples of tumors include colon cancer and ovarian tumor. In the left upper quadrant, the pain can be because of intestinal malrotation. In the right upper quadrant, it can be because of hepatitis, cholecystitis and peptic ulcer. And finally, in the right lower quadrant, the pain can be because of appendicitis.